I wanted to introduce Jim Brown. He is from the Actors Fund. This is his third time speaking with us on the subject, and each time the conversation is absolutely 100% different because the topic is changing so rapidly. I have never heard a better account of healthcare reform, how to get it, than from Jim. So thank you so much and welcome.
Thank you. Thank you. Thank you, Neil, for having me here today, Genevieve for inviting me. And Genevieve referring to me as Jim Brown because when I'm introduced as James Brown, I have to go, ow! I have to make some noise that satisfies that desire in people when they hear James Brown. I'm from the Actors Fund, and I'll just say a few words about that. The Actors Fund is kind of a misnomer. It goes back to 1882, and it was founded by people like P.T. Barnum and Buffalo Bill Cody, and people who were very involved in entertainment. And it was created for one purpose in 1882, and that was to bury actors in sacred ground. I know that seems extraordinary, but they would buy up plots because churches were refusing to bury actors because of the profligate lives they lived, and that's the origins of the Actors Fund. Now we wait until they're actually dead to bury them. It's an Actors Fund joke. They're generally money only to Actors Fund people. But we're involved in all sorts of stuff now. Affordable housing. We run a full-time free health clinic in Manhattan. We have a program that's supportive work for artists so they can continue doing their art and get lucrative work, meaning $20 an hour, $25 an hour, to help them support themselves as artists. We have programs for seniors, and the main thing we do, the thing maybe people like best, is we give out lots of money, okay? It's financial assistance. That is, we try to help people in the performing arts and entertainment get through tough periods of their lives, okay? The part of the Actors Fund that I run, which is the Artist Health Insurance Resource Center, is also, even especially for visual artists and craftspeople who we work with all over the country. So artists are in a position of being on the individual health insurance market, which is a very bad place to be because insurers do not want to sell individuals insurance. They can cost them all sorts of money if they become very, very sick. And the way insurance works is the insurer likes to transfer the payments and claims that they make onto the healthy who are sending in the premiums and not making any use of the healthcare system. Well, you know, I'm sure, how health care works. But all of that really is about the change, okay? Even in Pennsylvania, it's going to change. It's going to change. Dragging its feet, but it'll have to change to some extent. So what I'd like to accomplish here this evening is just really two things. One is to make you more informed about healthcare reform than 99% of the people in the United States, and you will be after this. I think you'll really understand the way this is supposed to work when it rolls out. And when is it rolling out? On October 1st of this year, okay? Most states will be enrolling people in plans that will begin January 1st, 2014. This AHRQ up here, ahrq.org, stands for Artist Health Insurance Resource Center, and that's a website with about 6,000 different resources on it for all 50 states and Washington, D.C. And we created this in 1998 with a grant from the National Endowment for the Arts, and it's gone through about 7 or 8 different iterations as time has gone on. So you might want to take a look at that. A lot of the information I'm talking about will be there. The second part will be where to get health insurance right now in this interim period. So we're going to talk about not just health insurance, but about where to get health care. We're going to talk about the delivery of care right here in Philadelphia and surrounds, okay, in clinics and that sort of thing. So there's two parts of it, but I thought we would begin with Christmas future first, okay, the healthcare reform. Well, some things have already happened, and I'm sure many of you are aware of that. Children under the age of 19 with pre-existing conditions can't be denied coverage. It's almost an amazing thing that we had to put in a law to make that happen, but we did, and that happened in March of 2010. So after March of 2010, no child under the age of 19 in the United States can be denied health insurance for any reason whatsoever. And they cannot be charged more for their health insurance because of some illness that they have. Young adults up to the age of 26 can stay on or enrolled in their parents' coverage. Many states have had this for years, okay? This idea began in the state of Utah. And the reason why it started in Utah was because so many Mormon youth go out as missionaries. And so the legislature in Utah said they should be able to stay on their parents' insurance. Okay, so that's the origins of that idea. Then other states, New Jersey has to age 30, New York has to age 29. But the problem with those state laws is that the person has to pay the full cost of the premium. Meaning, read this as COBRA. If any of you have ever gotten a COBRA letter and you have COBRA shock, you realize what the cost is of your health insurance that you've been getting from your employer or union. In this case, the child is just another family member, right? So they just added to the family insurance. There's no increase in the insurance. This is an extraordinary thing, particularly for artists, okay? For people who want to get right to it, okay, and begin their work and aren't constantly hounded by their parents to get health insurance, because if their parents have health insurance, they can stay on that health insurance, and they get right into the business of creating art. And I mean that. It's really a critical element, because you get that group between when they leave college, okay, or when they leave a community college or a four-year college, and then there's that interim where often they're working for a company that doesn't offer health insurance, or they're self-employed, okay? And the cost of insurance is prohibitive to them. So this is a very important feature, again, for our community. Insurers can't retroactively cancel the policies of people who get sick. This is called rescission. Now I should tell you part of my background, okay? I worked for insurance companies for 10 years. I worked as a contract negotiator. I set the fees for all the hospitals in Manhattan, for Empire and for Aetna, okay? And then I became a regulator of health insurance for the state of New Jersey in Trenton, okay? So I regulated the people I used to just work for, since I had seen all their contracts and I kind of knew what they were up to. It's a dirty trick, but they're up to dirty tricks, okay? So you learn about rescission when you work for an insurer, and what it is let's say you have a policy for 10 or 12 years, you haven't used it much, okay, and then all of a sudden you have a chronic illness or something that's going to be expensive, and someone pulls your file out at that moment and pours through it and tries to discover something that would disqualify you from them paying the claims. Follow me on this? So they find, for example, naughty you forgot to mention that you had asthma as a child, okay? And because of that, okay, they nullify the contract at that moment, do not pay the claims. But notice they took 12 years of your premiums, okay, before taking a closed look. This is now illegal in the United States for an insurer to do that. No more rescission. Insurers can't impose lifetime limits on medical benefits. People don't usually spend much time taking a look at that in your insurance policy. It usually is an amount of $1 million, $1.5 million, sometimes $5 million. HMOs, from their inception, were unlimited in the lifetime payout, okay? But most people might see that $1.5 million and say, that's plenty. That's going to be, walking through my life. Will I possibly use $1.5 million? And of course, probably the most famous case of that in performing arts is Christopher Reeve, who had a $1.5 million payout, lifetime payout, and went through that in 17 months, okay, through from a head injury. Okay? Now, in the United States, there is no longer lifetime limits on any new policy sold in the United States. You cannot have lifetime limits, okay? It's unlimited, right? That's a good thing. The law established a particular plan for people who had, and I've always loved this term, pre-existing conditions. Pre-existing conditions, it sounded like something I would learn in Existentialism 101 in college. Remember the pre-existing condition. Okay? Well, their idea of a pre-existing condition is, and the way most states define it, is anything you've had or been diagnosed with, was seen a medical professional for 6 months prior to your getting the health insurance. And then they either won't sell you insurance, or they won't pay anything related to that for up to a year, or they'll never pay for that particular thing. And there's all sorts of permutations of that. Okay? Pennsylvania is not a guarantee issue state. New York and New Jersey are, meaning you can be denied insurance in Pennsylvania. Some of you may have been denied insurance. So they established this plan, the PCIP plan in every state, okay? Pre-existing condition insurance plan. Pennsylvania's, okay, costs $283 a month. There's a $1,000 deductible and a 20% copay, okay? I was recently in Georgia talking about this about a month and a half ago in Atlanta, and part of this plan is you cannot have had insurance for 6 months, and you must have a pre-existing condition. Okay, kind of a little twist on it there. You have to have a pre-existing condition to get this, and there's a long list of them. And I happened to bring that with me and gave it out to the audience, the pre-existing conditions, and as I went on talking, in the back, someone went, woohoo! It was a little disconcerting. They found their pre-existing condition on the list of approved pre-existing conditions. Well, this was all in good, and it was a great thing because $283 is a good premium for getting health insurance, even with $1,000 deductible. Problem: the program just ran out of money. I don't know if you read about it in the paper, but these pre-existing condition plans that were supposed to last till December of this year, okay, because in January of 2014, there'll be no pre-existing condition waiting periods for adults. It'll all go away as for children, but they've run out of money. So, if you are interested in if you haven't had insurance for 6 months, and you have one of these pre-existing conditions, okay, just put that PCIP into Google or something, it'll come right up, okay? You have 2 days, okay, to get that. Probably Saturday is not a good day, so Friday, pretty much tomorrow is your day for getting that, okay? It's an unfortunate thing that it's gone, but there it is, okay? If you can't get it, don't leave your home between March 2nd and December 31st of this year, okay? Emerge on January 1st. Proudly announcing your pre-existing condition. So looking at this audience, I can see that there's absolutely nobody here who's even close to Medicare age, trying to compliment you with a pathetic attempt to and it never works. In any event, that law had certain things about Medicare in it, and one of them was it filled the so-called donut hole in the Part D plan for pharmaceuticals. I only want to mention it because well, my mother's 91 years old, and she hates Obamacare, just hates the whole idea of Obamacare, no matter how many times I explained it to her, okay? And yet, she's thrilled at the amount of money she saved because of the closing of the donut hole. In fact, $5.2 billion has been saved by seniors because of that one element of the Affordable Care Act, okay? So if you find a senior who's against, see, some people say Obamacare. I say Obamacares. Okay, and you can say that too if you want. Also annual wellness visits and certain preventive services are free for Medicare recipients. This might not seem like much, but previously they had to pay 20% of the cost. Okay, and that can add up, and they're in fixed incomes. So there's a whole long list of preventive care testing that is now completely free in the doctor's office for them. Okay? The last thing on here is something that's almost never talked about related to the Affordable Care Act. It has $5 billion set aside for community health centers. And a huge number of people in the United States receive their primary care from community health centers, and more are going to do that, and the reason is we don't have enough primary care doctors. Pennsylvania is missing 1,600 of them. Okay, that's the estimate. That we need 1,600 more primary care or family doctors in Pennsylvania. Other states like New York need even more. And why is that? Because so many doctors have gone into the high lucrative specialist professions and they can't get. So where do people go to find a primary care doctor? They go to a community health center. And a community health center is great because all community health centers run by the Bureau of Primary Care, okay? And how can you find yours? Amazingly, this doesn't sound like our government at work, but amazingly, the name of the site is findaclinic.org. Findaclinic.org, okay? And you put in your zip code, and then you'll find the one that's closest to you. You are charged in all of them by law based on your income. So it's a sliding scale for all of these. And you're going to get good care. The other reason why I mentioned clinics is because please, please, please do not use the emergency room of a hospital as your doctor's office. Okay? Because even if you're in there for even 2 or 3 hours, you're going to get a bill of $4,000 to $6,000. You think I'm exaggerating, but I'm not. You're a live body. You're going to hook you up to everything. You're going to get a saline drip right away. Okay? And they're going to check you for every possible thing. Okay? And the bills you're going to get aren't just from the hospital. They're from a corporation made up of emergency room doctors. They have their own little company working that's going to send you a bill. And you're going to get a bill from the radiologist if they took an x-ray. And you're going to get a bill from the pathologist if they took blood. Okay? So be careful with going to emergency rooms unless it's an true emergency situation. For me, coming from the Bronx, that's a knife in my back. Okay? If I have a knife in my back, I head to the emergency room. Otherwise, I'll find a clinic somewhere. Okay. Good. 2014, this is what's coming. Insurers can't refuse coverage to anyone. And most people will be mandated to have coverage or pay a penalty. Well, there's the deal right there. That's how all of this happened. There's the deal, okay? Insurers can't refuse to cover anyone, right? And the insurers, of course, only want healthy people. But the payoff was the mandate. Because the mandate delivers to insurers what they've always wanted. The young and the healthy who ignore them. Okay? So, they get the young and the healthy, many of whom make absolutely no use whatsoever of the healthcare system unless they get a chronic illness or a skiing accident, okay, or an accident on the dance floor. Okay? So the insurers see a huge boom coming with this mandate of having, especially young people. And look, they get what they've wanted forever, which is that you have to buy their product, right? And that was the Supreme Court decision, remember? Whether you can force an American to buy a private product. Because this is private. There's no public insurance with this whole thing, okay? And the answer was, yes, you can do that. There will be new insurance marketplaces called exchanges, and you'll see lots and lots of advertising for this in the next 3-4 months. They will offer insurance to those who don't get it elsewhere, okay? Your governor and the governor of 25 other states has decided to let the federal government set up the exchange. Okay, so the federal government, and that might not be a bad thing. It really might not be, because they could probably learn from each other, and the federal government has really geared up for this. And some of the states who have decided to do it on their own are already having all sorts of problems. Okay, California, remember, California is 1/5 the population of the United States. They're predicting it'll take them 5 years to bring the full population into health care. So it might be a good thing in Pennsylvania for that. It'll be run by the federal government. And what is that exchange? It's private insurers, okay, who are competing for your business. And that's the idea behind the Affordable Care Act. It affects the individual insurance market more than it affects anything else. After that, it affects sole proprietors, and after that, it affects small businesses, okay? That's what it's really aimed at, all right? And so its benefits will go mostly to that group of people, all right? Subsidies will be available to people who buy insurance through an exchange with income less than 400% of the federal poverty level. Right now, that's $44,680, and that's for an individual. Families are obviously will be higher. The FPL, the federal poverty level, the formula for it was invented in 1964, and it has not changed since then. Okay? It is the same for all 48 contiguous states, a little bit higher in Alaska and in Hawaii. So no matter where you live, it's exactly the same. And I'm going to tell you something awful now that I once said, and this was also in Georgia, but in Decatur, Georgia. And I was talking to a group, and I said, it doesn't matter where you live, whether you're in the middle of Manhattan or in the backwoods of Arkansas. And someone in the audience said, I'm from the backwoods of Arkansas. And I guess they understood that I was, you know, this is the height and this is the low here in the conception of a New Yorker. And the person said, you know, the backwoods of Arkansas is pretty nice. Okay? So I want to be careful with that sort of thing. Get the idea, though, that no matter where you live and the cost of living, that federal poverty level is going to be the same. And now you can take the American Poverty Test. If you're an individual and you earned less than $1,170 last year, you're officially poor in the United States. You're officially poor. You're below the poverty level. If you made $1 more than that, welcome to the middle class. It's absolutely extraordinary when you realize that you see statistics that 1 out of every 5 children in the United States is born in poverty. That's the amount we're talking about. A family of 3 making $18,000 a year, and that's how low the level is. So there's a word here that's very important, and it's subsidies. Okay, and that's why it's called the Affordable Care Act. It's these subsidies. And so you're going to be subsidized to get insurance, but what is this insurance you're going to get? How would they define a quality insurance? So we're going to see in a moment what's affordable. How do they define quality insurance? It's a package with essential benefits, and everything sold on that exchange will be the same. So you'll be buying the same plan, right? And most states are using as the plan the most popular small business plan sold in that state. Okay, so it's what insurers, for example, in New York, it's going to be the Oxford plan, okay, which is the most popular among small businesses. They're going to use that as the model for this individual insurance that you will buy. So it's ambulatory care, emergency care and hospitalization, maternity, prescription drugs. It'll be comprehensive, okay? And the good part is all of them will be the same. So you will not be in this position of saying, does this include chiropractor or does this? It'll be the same set of benefits, okay? So what's going to be the difference if it's the same set of benefits? Well, you know, I was asked by the South Jersey Cultural Council once to give a talk on health insurance at their annual conference. And I agreed to do that, and then I heard where the annual conference was. It was in Atlantic City. And I'm thinking, what kind of a nightmare is this going to be? Okay, in Atlantic City, in one of these rooms in the hotel with the buzzers going off and everything else. And I'm talking about health insurance. This is the well. As I'm walking through Atlantic City, I realized that this is the perfect place to talk about health insurance because our model of health insurance, we based it on gambling. Gambling, right? How lucky do you feel, okay? And how well have you counted the cards, right? So other countries, misguided countries maybe, based it on public health, right? They wanted everybody to have access because they want people giving disease to each other after World War II, right? And human rights, whatever. We chose gambling. So gambling, calculation, and luck, and we've kept that model for Obamacare. Okay, you're going to see how we did that now. Well, there are 4 levels provided in the Affordable Care Act on these exchanges. So the product you're buying is the same, but you can choose to buy the bronze plan, the silver plan, the gold plan, or the platinum plan. Okay, so this is what you're going to be facing in the next 4, 5, 6 months. So in the bronze plan, you pay 40%, the insurer pays 60%. Silver, you pay 30%, the insurer pays 70%. Gold, You pay 20%, the insurer pays 80%. And by the way, that gold plan is the way insurance used to be before the early 90s. It was indemnity insurance. It was called, then you went to anybody you want to, the insurer paid the 80%, you paid the 20%. And then there's that platinum plan where you only pay 10% and the insurer's going to pay 90%. I was at a meeting in Washington, D.C. when this was announced, and I actually did raise my hand and asked them if there was going to be a titanium plan, which is the one where the insurer pays 100%, and that's the one I'm looking for, okay? But they don't have the titanium. Is titanium better than platinum? I guess it's not. See, my nephew has a titanium bike that weighs like 3 pounds, so I'm always impressed by titanium. In any event, that's the decision you're going to make, and what's going to be the cheapest of these plans? What's going to have the lowest premium? Well, the bronze plan, because what's happening here is the cost is being shifted onto you, right? But you see how the gambling comes in? Right? You're saying, what should I get? Do I think will I be hit by a bus this year? I don't know. Maybe, you know, how many times will I have the flu? You know, because that's what you're doing, right? You're taking a chance, okay, on, okay, your share of the cost of these things, right? So, good. That's the way it's going to be set up, right? Get ready for it. There's a fifth plan for those who are under the age of 30, and that is a high deductible or so-called catastrophic plan, where the deductible in the law, it says, will be $5,950. That amount has gone up since the law came out to about $6,220. It's going to go up each year depending upon inflation. But it's around that area, okay? So you would pay out of pocket $5,950 before the insurance would kick in, right? And then when it kicks in as a silver plan. You following this? Not at 100%, but it's a silver plan. Now, who would purchase this type of plan? People who just feel they do not really make any use of the healthcare system. They're healthy, they don't need it, they don't want to pay a high amount in the premium, and once again, it's a kind of a gamble with it, okay? But heavy limits have been placed on your out-of-pocket costs in this law. And this is really key to the understanding of the Affordable Care Act, okay? By the way, this number, $5,950, anybody here have an HSA or a health savings account? That's where the number comes from originally, because that was the limit of what the deductible could be for a health savings account when they were invented. Okay, so they just took that number from the HSAs. Okay, a health savings account is where you have a catastrophic policy like this, and then you can put pre-tax dollars into a savings account, rolls over from year to year. If you use it for anything related to your health, these will still be sold, by the way. If you use it for anything related to your health, it remains untaxed. At 65 years old, it becomes essentially a 401k or a 403b. Just you can use it for anything you want. So here now we have the plan must limit enrollees out-of-pocket expenses. Out-of-pocket expenses. This in insurance, there's a better word for it in real insurance. The word for it is stop loss. Okay, so what they'll say, what is the stop loss on that policy? And that means the loss to you. $5,950 for an individual, $11,900 for a family. Those are going up. These are the 2010 figures. What does this mean? Its intention is that no longer in the United States will a person have medical bills of $80,000, $120,000, and these are not difficult amounts to rack up. Okay? Many of you know the famous Harvard study where 49% of all bankruptcies over a 10-year period, the main component was hospital bills, okay, and medical bills. What's often not told about that is 70% of those people had health insurance. It just wasn't very good health insurance they had, okay? But now in any given year, your out-of-pocket cost will be limited to $5,950. This does not include the premium, okay? So you're paying out the premium, and that just goes on, but you can, but once you show that you've paid more than $5,950, you pay nothing else for your health services. Now, how fast can $5,950 happen? Okay, well, I was a hospital negotiator at Empire, as I said. Okay, and I would say that even at a negotiated rate, let's say Horizon Blue Cross, a Blue Cross plan. What do you guys have here? You have, was it? Keystone, right. So I'm guessing, but at Hahnemann Hospital, let's say Keystone, 4 a night pays $2,200 now. Okay? The actual charge of that hospital is probably about $7,000 or $8,000 for anybody who's uninsured. That's called a charge master. Okay? And you all understand this, right? Part of the awfulness of being uninsured is that not only are we responsible for the bill, but the bill you're responsible for is exorbitant. And how exorbitant is it? It's usually about 5 times what Medicare would pay. Either for a doctor's visit, for a surgery in the hospital, 5 times. And you're responsible for that bill. I'll give you an example of it. I had my right hip replaced about a little over a year ago. I had my right, it was from arthritis. I had my left hip replaced. I don't want to tell you all about it, but I had my left hip replaced 12 years ago, and that was from a motorcycle accident. So I like to talk about that one, which is more romantic, and happened in Madrid, Spain, than just the arthritis thing. I really had arthritis, had that hip replaced. Well, it was completely paid for under my health insurance. I went in network and did all those things, but I asked, what was the bill? Okay, it was the Central Jersey Somerset Medical Center. And what was the full bill for the replacement of my hip if I had had no health insurance? It was $87,240. That was their charge, okay? So we're completely out of whack with this stuff, okay? It's just wild fantasy charges. In any event, the Affordable Care Act does not do much to suppress the cost of health care, but what it does, it protects individuals from this type of ruinous, absolutely ruinous debt, okay? So be aware of that. Now we come to it. Do you have to have health insurance? Yes, you do, unless you fall into a number of certain categories. Native Americans are here because they have their own healthcare system, although many of the tribal groups are buying into this, have decided to buy into this. So religious objection. And here's what I love, which is if anyone making less than $9,350 as a single person is exempted from the mandate. Okay? But of course, what's going to happen to that person is going to have access to Medicaid. Okay? But they're exempted from the mandate. And you will not be fined if the period of your time without health insurance is less than 3 months. Okay? So whenever you want, you can go 3 months without health insurance and you will not be fined for doing that. And the reason they did that is because of people who are transitioned. They've lost their insurance to a union. They're going to be on the insurance again in 3 months, and so they can go without it and not be fined. But I'm sure you're shocked by the amount of the fine. And in the first year, that fine is $95 if you don't have health insurance, or 1% of your income. By 2014, we get to $695, or 2.5% of income. Okay, so what are we going to have? Well, we're still going to have people who just simply decide that they're going to pay the fine. They're just not going to get the health insurance, and they'll be able to do that. How are they going to levy this fine? It'll all be done through taxes, as you probably guessed, okay? There'll be tax credits, money taken from taxes, etc. Okay? Now, how will I afford the insurance? Okay? Well, this is important to understand. If your annual income as an individual is less than $44,680 right now, you'll receive a subsidy to buy insurance through an exchange. That subsidy is coming from the federal government. Okay, it will continue to come from the federal government into 2019, and then the states will begin to participate in that. Okay. Subsidies will do a couple of things. They will cap the amount you spend on premiums in relationship to your total income. Now here is an incredible idea, right? So what the law does, it defines what affordable health insurance is in this country. And do you know what it is? It's 8% of your income. Okay, so that's what it was decided. That's what affordable health insurance is. And in fact, if you cannot find a plan, even with subsidies, if you cannot find a plan that makes you pay less than 8% of your income, the mandate does not apply to you. Okay, so they're making sure that these subsidies will work to bring the costs down at 8% or below 8%. Okay, so the subsidies are going to cap the premium depending upon your income. They'll also cap your annual out-of-pocket medical costs. Remember we looked at that $5,950? Okay? Well, here's an example. I think you'll understand it with this. So it's two ways that the subsidy is working here. A person who makes $21,000 a year will have their premiums capped at 6.3% of their income. Right? And that's based on the silver plan. Okay? So that it's capped at 6.3%. Notice it's lower than 8%. Because their income is lower than $44,000. $44,000 is 8%. And their annual out-of-pocket medical cost will not be $5,950. It will be $1,983. Remember, this excludes the premiums. So do you follow me on this? For this person making $21,000 a year, the most they're going to pay out of pocket in any given year is $1,983. And after that point, the insurance kicks in at 100% and pays everything. Is it going to work perfectly? No. Okay, there's going to be all sorts of problems with it, as there was with Medicare when it first came in, with Medicaid when it first came in, with Social Security, with all of the major social programs, okay? But the benefits to the society are extraordinary, okay? Yes?
I have two questions, starting with that one there. If somebody's under that, it means that it doesn't make any difference whether they have a bronze, silver, or platinum plan, because after they've reached, if I've got it right, after they've reached that 1983 or whatever, they will no longer have to pay any more. And that would be similar to the other chart that you had, which said that there was a limit to the total out-of-pocket.
Yes.
Right, so that it doesn't really make any difference then which level plan you get.
Right, right. And so the level of, that's a great point, you know, the level of plan that you get only matters within these limits, right?
Right.
So you're going to be paying out more money up front, okay? But you may come faster then to your limit, right? So yeah, absolutely, that's correct, yes.
I'm just curious, the subsidies in relation to this cap, is that, in terms of who's paying for that, is that government money that would then come in?
Yes.
Or is it the health insurance because, you know, they realized that everyone's going to have to buy, so then they said they'd cover it?
It's both really. First it's the government, okay, and you know, that debate has happened, whether it's actually going to come from getting rid of waste in certain programs and, you know, various streams. What insurers have done is, over the past years, they've raised the premiums, okay, getting ready for this, okay, thinking that why not raise them since the government is going to be subsidizing some of this. Within states, and this is really where it's a states' rights thing, the Attorney General or the governor of a state has the right to limit the amount that an insurer can increase, okay, a premium from year to year. It was just done in New York. The insurers asked for a 22% increase, and Cuomo limited it to 7%, okay? California, they just let them do whatever they want, and in fact, they did go up to, some of them went up to 22%, okay? Eventually, okay, the savings, we're hoping it'll go down by the competition for, I imagine, people like yourself, okay, who are young and healthy. That's where it's going to go down. Okay? I want to make one point about that as well. If I'm in a state like Pennsylvania where they can take my age into account right now for health insurance, okay? I'm 63 years old. I know you're shocked by that. A plan that would cost someone, the same plan would cost a person 22 years old about $140 a month. Would cost me over $1,000. Okay, so that's the as you get older, once you're over 40, it accelerates very, very quickly. By the way, I'd make a point on that. Traditionally, in the United States, women have been charged more for health insurance than men, okay? And sometimes considerably more. And the reason often given for that is childbirth, is maternity care, okay? Now, men after 40, and women under 40 pay more, then men over 40 pay more, and they say it was because of heart attacks. Well, the problem with the women argument is that even when the policy did not include maternity, it was still more expensive for the woman. And so can anyone guess why health insurance was more expensive for women and is more expensive right now for women?
Is life expectancy?
It could be that, and they use it more, but they use it more. That's it, okay? A lot more than men. They don't go too much. They don't go too much. No. They don't ask directions, and they don't go to the doctor. So there's a lot of other problems about that. Okay? But it's the use that's made of it, so they just bounce up the premium because you're going more. And they're gonna have to pay more claims out for you. Okay? So good. So we have a sense of how this works, okay? Now we come to, and how many people will this bring into the system? It's believed it will bring in about 14 to 16 people. Additionally, will have health insurance in the United States. Okay? So just this whole mechanism will, through the subsidies, will allow that many people to afford health insurance because the number one reason why people don't have health insurance, they can't afford it. Yes?
So if you want to go into an exchange, but you're already insured, so how are you going to be affected by that?
Insurance you can drop from month to month. Yeah, you can just drop your insurance and go into the exchange if you get a better deal. And that's a very good point. I'm glad you brought that up because there's still going to be insurance as it exists now. I mean, they're still going to be selling these policies and all sorts of travel insurance, and they're going to be selling a PPO somewhere. So some are going to be on the exchange, and only the ones on the exchange will have these essential benefits, right? So we have to see how they're going to compete, right? But why would you buy it off the exchange if you can get a subsidy, right, for buying it on the exchange? Yes?
Also, when you can get the the 80-20 plan or the 60-40 plan, but isn't that the percentage of the allowable that the insurance company is willing to pay?
It's the UCR, which is the usual customary reasonable fee, which has been negotiated with the medical entity by the insurer. That's what that is, okay? And I can see you know your stuff, because you know that the word percent by itself has absolutely no meaning whatsoever, right? Now, I used to use kind of a mnemonic device for this. A Bronx story. In the Bronx, when we were teenagers, we would go up to the Grand Concourse and we'd go to a Chinese restaurant and eat our Chinese food there, which was only chop suey in those days. That was what Chinese food was. And then the fortune cookies would come out, and we'd break the fortune cookies, and we were 15 years old or 16 years old, and we'd read the fortune, and does anybody here know what the secret of the fortune cookie is? What do you say after you read the fortune?
In bed.
Ah, thank you. Perfect, in bed, okay? Now, at 14 years old, that's the funniest damn thing. No matter what it says, you say in bed, it's going to be funny. It still is kind of funny. You say it, okay? So, to this day, I can't read a fortune cookie without adding in bed. Now, when you hear the term percent, okay, there's something you should say, and I'll never forget, I told the story once, and someone in the front said, in bed? I think you missed the whole metaphorical aspect of this thing here. You want to say of what? Because percent doesn't mean anything if you don't say of what. And I'll never forget going to my wife's hometown, which is Volgograd in Russia, which was Stalingrad during the war. And this was just after the fall of the Soviet Union. And there was a store that had in the window a big sign that said 95% off everything. They were just beginning to understand capitalism. You know what I mean? Those poor people who bought the day before. Why this is important, the percent, is that if it's a percent of the negotiated fee, okay, then you'll be told what your part of that is, okay? So it's a set fee, all right? However, those of you who have ever had an insurance plan and then went out of network, right? You went out of network, right? And what did you discover? You discovered that sure they pay 80%, but they only pay 80% up to what they think the service is worth. So let's say that was $100. They're paying $80, and you're going to pay $20, but the doctor is charged $290. Right? You're at a network, you have to pay the rest of that. You thought you were only paying 80%. Is that what you're referring to?
Right, and then the allowances sometimes, they don't change for years.
Yeah, yeah. Well, this is, but that all has to do with the negotiation that takes place. And by the way, on the exchange, okay, they're going to be in competition with each other to lower those, okay? To lower those co-pays, the deductibles, etc. Okay? We hope anyway. We'll see what happens with it. Yes?
What was the argument based on people who weren't for Obamacare, based on that say, well, now things are going to cost us so much more money? As like my daughter who works in a hospital, now there is going to be less jobs, and so I sort of tried to explain it to her. Their belief was that we're going to lose jobs in the healthcare system, blah, 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 blah.
Yeah, there's
What
going
was that
to be
based on?
32 million more people in the health insurance marketplace. It's not going to mean less jobs, okay? What is true and what needs to be understood is that in the beginning, the cost of insurance might go up, but it's not going to go up for you if you're subsidized. You follow me on this? You're going to see the cost go up, but you'll be paying less because there's going to be a subsidy for it. And the hope is that this will eventually even out and then begin to descend, okay? I think what we need to realize with this, as with anything this big, it's a social experiment, okay? And we're going to have to see how it plays out. There are people hoping it doesn't work, okay? Hoping anything the government sets up doesn't work, right? And trying to block it. And then there are those people who are trying to get it to work because it benefits or should benefit so many people. Well, yes.
How are companies going to be giving you a better deal if what they're selling you, you said, is the same thing?
Well, it's their overhead costs, and that's another aspect of the bill, okay? This pushes them to lower their administrative costs in order for them, okay, to be able to lower the premium. So there are fines right now. If an insurance company does not use 85% of its income for direct medical care, it's fine, and you get the money back, okay? So what I mean by that is, let me give you an example. The administrative cost for Medicare is 4%. Okay? The administrative cost for a company I worked for, Aetna, at the time I worked for it, was 32%. Okay, so that's salaries, that's big salaries, okay? And lots of other stuff, right? So it's now to the point where it's going to be 15%, and they'll be competing by lowering the premiums on this. There's something else involved with this, and that goes back to your question as well. Should you leave your old insurance and go onto the exchange? These are going to be networks. So if your doctor or a hospital you like is not in that network, you may stay with what you have, correct? Because what is the product they're selling? It's not just the benefits they're selling a network, MRI centers, hospitals. And just on that, you know, I don't know if you've ever been in a position, you get a job and they give you a book and you're supposed to pick a doctor out of the book. You know, you kind of go through the names and you have no idea who these people are. The fact of the matter is, if you're ever in that situation, you shouldn't pick a doctor, you should pick a hospital. Think of a hospital where you would want to be if you had to be in the hospital, and then just find a doctor that has admitting privileges to that hospital, okay? Rather than picking the doctor, you know, because you don't know where they're going to be able to send you. Yes?
Just one question. We live in a tri-state area. Some people live in New Jersey, some people live in Penn, Pennsylvania, and Delaware. The exchanges, how do you decide which exchange, or are you eligible for any of those exchanges?
No, just in your state currently.
The state you work in or live in?
Where you live, yes, that's correct. That I say currently because in the original plans for the law, it was going to be across state lines, and that may still come. It is across state lines for a product called co-ops, but I don't think you have any in this area here, okay? But these will be, mostly farmers have them actually, all right, in the Midwest, where the people will participate in the earnings that will come from the profit from the healthcare plan, okay? It's going to be one. It's going to be one in New Jersey. I'm sorry, there'll be a co-op in New Jersey. It might be possible for Pennsylvanians to do that, but you'll be told about that at the time. Okay, but right now it's state-based. Yes.
I get my insurance through a union, Actors Equity.
Yeah.
I'm curious how you think the ACA is going to affect union plans.
Yeah, this is a huge question. Some of the unions, and of course we say union, there's the union and then there's this whole separate entity, pension and health, right? They have to be separated. And the people in pension and health are somewhat worried that people who have the insurance through the union, okay, who have earned eligibility, right, will actually leave that insurance and go on to the exchange where they'll get a better deal. And that could be the case with younger people. So they're worried about it. And interestingly, there is nothing in the entire law said about multi-employer unions. And it was just a complete mistake that they didn't focus on this. So everybody's kind of up in the air. And again, the rules and regulations haven't been written for this. I've talked extensively with your guys in your pension and health. And they're desperately trying to lobby in Washington to get something put into the law now.
What would they put in?
Well,
Like keep me in my union plan?
no. What they might do is they might be able to put theirs on the exchange, for one thing. Okay? There's a lot of different possibilities. I'll give you another one. You may be able to be subsidized if your income is below a certain level. So the $100, whatever it is you pay, you wouldn't have to pay. You pay $40. There's a lot of different, permutations to afford. And in fact, that's a huge thing that unions want right now, and that's being blocked, is to participate in the subsidies. For their people to be allowed to participate in the subsidies. I'm sure your union is asking for that right now. Yes?
So if you have insurance now, and you choose not to go on the exchange, can you still be subsidized if your income is below a certain level?
No, you have to be, the subsidies on the exchange.
So
All of this is for the
So
exchange.
you have to leave your insurer then?
Yes. To get that subsidy, you do. Okay? Now, certain things will still apply to you. Any new plan that $5,950 has gone up to $6,000 something, that still will be in effect for you, whether on the exchange or not. That'll be the limit of your out-of-pocket costs.
And is that going to be related to income, like when you had a percentage, it's actually less?
No, if you're off the exchange, it doesn't.
And that number, the lower number of the percentage one, what percentage is that? What's it calculated on?
Which percentage do you mean?
The 1900 version. If you had earned 22,000 and you were on the exchange, so you had partial subsidy.
It's a sliding scale.
It is. Okay.
Yeah, it's just a sliding scale. And by the way, they tell us within a couple of months you'll be able to go onto a computer and see, even before October 1st, exactly what you'll be eligible for.
She had a question first.
Yes.
Where do you go to get an exchange? Like, do you go to health insurance?
It's the magic question. They don't exist yet, okay? And there'll be people called navigators and assisters who will be paid. I know in California they're paying people $58 for everybody they sign up for the exchange. That's what they're going to try to get people into the exchange. So it's going to be like, census takers or whatever. It's going to be a little job that you have.
There were some exemptions and some things that go into effect if you have. You had said the lifetime limit for all new plans, but if you stay on your existing plan, do you know what I'm saying?
I got you.
Yeah.
What happens is any new plan that you're in, so you could be on a plan that's an old plan, it's kind of grandfathered. But once they rewrite, if they change anything in your plan, then these things go into effect.
And so would it be renewal time, or could it be if anything changes?
Renewal.
Okay.
It'll be at some renewal point.
Okay.
Now, if they don't change it at the renewal point, they don't have to include these things.
Oh, so they might
But
do
they're all
that.
gonna,
Yeah.
within a few years, it's going to apply to everything. Okay? Yes.
I have an interesting question. When they look at incomes, if they're looking at for two people, family incomes.
Yes.
Are they looking at family incomes, or are they looking at single person?
Family.
I said, what if one of those people in the family are already on Medicare?
Yeah.
they're going to still look at the two-family income. They're still going to look at that two income.
No, I see what you're saying. Does the person on Medicare still have an income?
Yeah,
Yes, it's the household income.
okay, so that's actually going to hurt the other person.
It could.
Getting into the exchange,
Yeah, I hadn't
and
really
the other
thought about,
person's
I hadn't really
making
thought
money.
about that.
Right.
How do you stop working?
Well, there's something called renewals.
Oh, okay, I see.
That person isn't working, but still making money.
Right. Yeah,
That'll hurt the other
it'll
person.
be household income, it could, yeah.
Interesting.
Yeah. Okay, we're good, yes, a few more questions, we're going to Medicaid. Yes.
Oh, sure. Well, my husband and I are both self-employed and separately self-employed, and we benefit from the self-employment, the health insurance tax credit.
That's great,
Is it going to survive?
yes.
Okay.
Yeah, I'm going to talk about it in a minute.
Okay.
Yeah, that's a great thing. You're probably one of 4 people in the United States without that. I'm serious.
What happens if you're in an exchange and you get to age 65 and for some reason you're not eligible for Medicare? Can you stay in the exchange?
Yes. Why would you be eligible for Medicare? Not knowing of work history or?
Yeah.
Okay, yeah, you just stay in the exchange, you just purchase your insurance.
Just like now, if you're in a private plan, you
Sure.
don't have to go into Medicare.
Sure.
You're private.
And remember, you can purchase Medicare as well. Medicaid can be, for those who aren't eligible, it can be purchased. I think right now it was $390 a month, a little expensive. But everybody pays, it's $104 for Part B now, people are paying. You'll have to see when the time comes what that's going to cost. Okay? Yes?
I'm not understanding what the employer's role is in everything that we're
Terrific.
talking about.
Yeah, great. No small business has to offer health insurance. Okay? Small businesses under 50 employees, they are exempt from, they don't have to do it now, they're not going to have to do it in the future. Okay? Any employer that has 50 or more must offer health insurance or pay, which is a huge fine. Okay? It's going to go up to something like $2,000 something per person. So they'll have to pay that fine for each of those people who they're not insuring. And those people will then probably go on to the exchange. Okay? This is the type of thing you hear with like Domino's Pizza or some of these companies that say, well, they have 48 employees, they were going to hire 10 more, but then they'll have to offer health insurance. Okay? And that is a problem. That dividing line. And I think whenever you have a dividing line like that, it can create problems. Okay? But generally, it's predicted. The interesting thing about a thing like Domino's Pizza, a lot of these places already offer health insurance to their members. They're just going to be forced to do it. Okay? We're in a position of doing that. I want to say something about Medicaid, and this affects not necessarily you in the room, but maybe many people you know. I'm sure you're aware that your governor has decided not to accept the federal Medicaid money. Okay? That amount of money is $37.8 million over 10 years, for which the state of Pennsylvania would have to pay $2.8 million. Okay, so you pay $2.8 million to get $37.8 million in aid. The number of people, and I'll explain how that would have happened. The number of people who would be eligible for Medicaid, additional people eligible for Medicaid in the state of Pennsylvania, is 520,000 people. Okay? And why is that? Because what happens with Obamacare is that the cutoff line for Medicaid moves up to 138%. Okay? You'll see it as 133%, but that's not accurate because the law has a different way of calculating it. So it's actually 138% of the federal poverty level, and how much money is that? It's about $14,000 a year for an individual would be eligible, up to $14,000 a year would be eligible for Medicaid, and single adults would be eligible for Medicaid, which they're not in New Jersey or in most states. There are very few states, New York is one of them, where single adults are eligible. They would be eligible in Pennsylvania, okay, and make up to $14,000 a year. That's not going to happen here. It may change somewhere down the line, but it was quite a decision to make. As I think you know, Christie, who was adamantly against all of this, 2 days ago made the decision to accept the money. As did Kasich, as did, who's the woman in Arizona, who's the, Brewer accepted the money. okay? Rick Perry in Texas did not accept the money. So we'll have to see how this plays out because it has a huge social effect. Now, just to give you an idea, what is the percentage of the federal poverty level in Pennsylvania you need to be at right now to get Medicaid, okay? For most people, it's 68% of the federal poverty level. You follow me on that? So that's how low it is. So it moves it up from that to 138% in the country that brings in 16 million people. So that's, for the meantime, that's not going to happen yet. And those of you who have been thinking of moving to New Jersey might want to think that now, yes.
If you're like right near that line and you're self-employed and you're going back and forth, and you start out and you can get in the subsidy for the actual insurance,
yes,
but you go below it, are you required to go to Medicare?
You mean Medicaid?
Medicaid?
Well, in this case, in Pennsylvania, do you live in Pennsylvania?
Yeah.
Okay, Pennsylvania is not going to have this. Okay, at least in the near future, or until Governor Corbett, is it Corbett or Corbett? Corbett, sorry.
Yeah.
Unless he changes his mind or unless the legislature does something, okay? So this isn't going to be in effect, all right? What happens with almost all social programs, though, just for your knowledge, is you get the insurance for 1 year, and then you have an anniversary that comes up, and you have to show you're still below the level, okay? And what is the look back? The look back is usually 3 months. So they want to take a look at 3 months of your income. If you're still below that level, you remain on that insurance. Now, Medicaid, of course, is great insurance. There's no premium for it, okay? Some places it's difficult to find good doctors, but most places not. Terrific insurance. And Pennsylvania, by the way, has its own kind of social program. If I have just a few minutes, I'll mention some of those. Spend a long time on this. But yes, you have it for the 1 year. Even if you fall below during the year, it doesn't matter. It's
well,
just
they're not going to have a Medicaid here. Does that mean that you can get the subsidy
if you're a single adult in Pennsylvania right now and do not have children, you cannot get Medicaid. Okay, you either have to be blind, you have to be a pregnant woman, you have to be the mother or father of a impoverished child. I mean, it's very narrow, the frame in Pennsylvania for getting Medicaid. This would have changed all of that. It's not going to happen.
Does that mean that you then can get the subsidized insurance if you're below that cutoff?
Ah, I see. Yes, of course. I see what you're saying. Yes, and in fact, it'll go very low, right? Won't it? Because it's on that sliding scale. I see what you're saying. I didn't. Yeah, that's a great question. What happens in those states that don't accept the Medicaid?
So you get the same quality insurance.
Yeah. Sure.
And you wouldn't be stuck with
Sure, and you'll pay a low premium on it, and you'll be capped at a low amount. Great question, because they have to do that for those states that didn't do this. That's going to be interesting. By the way. Yeah, it will. Yes.
Just repeat that question and answer.
Right here. Yes. What he was saying was, so in Pennsylvania, Pennsylvania has not accepted the Medicaid money, which would bring Medicaid eligibility up to 138% of the federal poverty level, okay, which I have here is $15,414, okay? So, what if your state didn't accept it, and let's say you make $12,000 or $9,000 or some amount that does not qualify you, it wouldn't qualify you anyway, you're not of that population for Medicaid, but let's say you're at that rate, what's going to happen is you're going to be subsidized also on the exchange. And you're going to be paying quite a low amount on the exchange for the insurance. So, and they'll have to do that in every state that doesn't accept it. Most states are accepting the Medicaid money. As more of these governors begin to find out what the people in their state want, and in Texas, he's just gone against the popular. 70% of the people want it in Texas, and they just went against it. So, all right. So, a couple of last things with this. There'll be coverage, lots of coverage, preventive services in all of this. You can see what they are there. That's one of the reasons, by the way, that the insurance also is going up a little bit because someone's going to pay for it. And they want to pay the premium because they have to give these tests either for free or for low cost. Now for the small business tax credit, where is the woman who has that here, the genius in the room? No, I really mean that. It's the most underused program in the United States. Here's what it is. In March of 2010, this law came out. Remember everybody was saying there's 2,000 pages, no one's going to read it, whatever. That woman read it, and what she found in it was the small business tax credit. And here's how it works. By the way, at the Actors Fund, we've been desperately reaching out to dance companies, small theater groups, independent video producers, all these people to get this tax credit. Here's how it works. If you are in a company that has 25 full-time equivalent employees, not 25 full-time employees, so you can have part-time people, it just has to be below that amount, okay, of 25 full-time employees, and their average wages are less than $50,000 a year. I think that's not going to be too difficult for some not-for-profit arts organizations, okay? Then you may be eligible for the tax credit, and if your organization pays for 50% of the premium, okay, pays out 50% of the premium, then the federal government at the end of the year will pay for 25%, okay, of the premium. So you get 25% back. You pay 50% on it, you're going to get 25% back from the federal government. It's going to be a tax credit, okay, or it'll just be if you don't make enough profits to pay in taxes, you're going to get a check in the mail, okay, to pay for that.
That includes nonprofits?
Yes, and nonprofits right now get 25%, for-profits get 35%. As of 2016, 2014, okay, it'll increase to 35% for nonprofits and 50% for for-profits, okay? So, obviously, the organization would have to have the money to pay for the 50%, the half of the cost of the premium, and the employees would have to be willing to pay their 50%, okay? It's not limited to 50%. The organization could pay 75% and the employee 25%. But, so you have to be in that situation where people have the money, willing to do it. But clearly it brings down the cost of insurance, does it not? Because now, instead of paying 100% of the premium, paying 50% of the premium. And it's great for the employer, and many employers simply pass that money on to the employees, the money that's returned to them, the 25%. Okay, so it's a fantastic program. Those are the IRS forms for those of you who are interested in it, and the website is written in what you're following along with in your head. You know, I love this URL because it's so typical of a government URL. To find the form, you have to go so deep inside on like a Hobbit journey into the IRS website. Here are some resources and links to tell you more about what our topic has been here today. And I see we're already at 48, so I'm not, and there's another number you can call, 265. If 265 is a general number, but if you want to get me directly, it's 166. And there's my email address as well. When I taught, which I did at NYU for 14 years, in the Tisch School of the Arts in the drama department, and I taught in a program where the people for 3 days a week were going to be professional actors. They were going to Stella Adler and Lee Strasberg and these people. But 2 days of the week they had to take academic courses, which is what I taught. So I taught Shakespeare and I taught Greek tragedy and a few other things, which was completely the sideshow at the circus, and they could care less. But I taught a course called Theater History 1 and Theater History 2, which was, you had to take that course, whether you liked it or not, okay? So that was it. So it was a room full of 200 or 225 people. And in Theater History 1, every year, I would do something called the Peking Opera Endurance Test, okay? So I would bring in a recording of Peking Opera, and I would put this on, okay? And then I would count the seconds before someone screamed violently, turn that off. My ears are bleeding, okay? I mentioned that to you here. I personally love Peking Opera, but it's tonal ranges that we're not quite used to. I mentioned that to you because you've been amazing in taking this time, okay, and not someone not screaming out, stop, for God's sake, talking about health insurance. Because it really can be a tough subject, and you know, my definition of a professor is someone who talks in other people's sleep. You know, I haven't seen too many. I still tell people dozing off, but you probably deserve that sleep. The other thing, and really, do I have 15 minutes? Okay, 15 minutes. If you take a look at, there's a second sheet there, and it says on it, getting and keeping health insurance in Pennsylvania. And everything you need to know about getting and keeping health insurance in Pennsylvania is on that sheet there, okay? But if you look through it, okay, there are programs that you might not be aware of in Pennsylvania, okay? So let's say, look right through. There's a website that we run called the Dancers Health Insurance Resource Center, because we were given some money by the Doris Duke Foundation, and that's DHIRC, DHIRC.org, and it is there. You know, thank you for reminding me. You just click on Philadelphia, and you'll see this PowerPoint. Going through it. So, school-related options, and this is kind of guerrilla insurance. You have to have insurance to go to. You have to have insurance to go to university in the United States. Does everybody know that? Yeah, you can't go to school without insurance. So, because of that, schools usually make arrangements either with a hospital network or with an insurer. Okay, I looked up the University of the Arts. And they offer a plan. All you have to be is matriculated, and you get if you have 6 credits, you're matriculated, and the insurance plan is terrific. Now, I'm not suggesting that you go to school just to get health insurance, okay? You know, this is, I'll tell you something that's true. When I first got to the Actors Fund about 10 or 11 years ago, and I was put in charge of this, I suggested that the Actors Fund begin a dating service. I'm serious. And we put people without health insurance together with people who have insurance. Okay? And believe me, there are worse reasons to get married than to get insurance. And I see some recognition there. I've lived that myself in my first marriage. But it seemed like a great idea to me, and then they thought there would be legal problems involved with this. But then someone came up with what I thought was even a better idea. We get people in Europe who have socialized medicine to marry people in the United States, and that way the person gets insurance and learns another language at the same time. Which, what could be better than that? Anyway, none of those things have come to pass. But if you're thinking about going back to school, it's a good way to get health insurance, and these are generally excellent plans that they have. And the cost of them is 1/3 of what you would pay on the open market. Okay. This here, why I do this? This is when I try to get creative with a private insurance rates. The fastest way for you to determine what a private insurance plan is going to cost to you in your zip code is to go to the site called ehealthinsurance.com. And the only reason I tell you about this site is because you're not going to give them any information where they're going to call you during dinner. Okay? So all you give them is your zip code, your gender, and your birthday. That's all you give them. Okay? And they will be able to give you a very, very close idea of what health insurance is going to cost you right there. Okay? Now, some of you may not know this, but insurers have to be licensed to sell insurance in every county that they sell insurance. It's by county. Okay? So there are different ones being sold in your county. You have to put the zip code in. And then you'll learn about health insurance very, very quickly with this because you'll go into the plan details and you'll realize that as the deductible goes up, the premium goes down, okay? As your copay goes up, the premium goes down. So what it's all about now is just a cost shifting onto you. So anybody who gets health insurance and actually has the goal to use it, okay, is going to be paying heavily, okay, for that. But so it's e-health insurance. Check it out. It's a fast way for you to understand that not every insurer in your area is on that website. A lot of them are, but they pay to be on this website. In fact, they make it easy. You can enroll just by clicking something on there. But I'd wait until the exchanges come in. And by the way, e-health insurance is what the exchanges are going to look like. It's going to be something like that you're going to go to get the insurance. I show this because people sometimes ask about getting medical insurance for abroad. And we looked into it at the Actors Fund because we have a lot of people going on cruises and entertainers on cruises and that sort of thing. And this is one here that we found that looked pretty good. Why did it look good? Because the most important thing in travel insurance is that it pays for your evacuation as quickly as possible wherever you are and gets you home again. That's really what you're paying for. You follow me on that? So that's the real cost of it. I won't go through that. PA Fair Care is gone. Those are the federal poverty levels, and we talked about those. Medicaid we talked about. Now, there are programs in Pennsylvania. I hope this is still in existence. I forgot to look on the internet. Does anybody know a program called Special Care?
Yeah, it still exists.
Good, okay, good. It's an interesting idea, right? Because you have so many people uninsured in Pennsylvania, and Philadelphia area. You get 4 office visits a year with it. Okay, they cover maternity, surgery, ER. But there's no coverage for drugs, mental health, substance abuse treatment. Okay, that pretty much cuts out any actor getting that insurance. We'll agree on that. If those benefits aren't available, that's the end of it. So you might want to look into that plan. Do you know what it costs now?
I think it's like $151, between like 130 and 150.
Yeah, that's what I thought in that area. It's a good deal. Okay, so if you don't have health insurance, you might want to look into Special Care. Oh, there it is. It was $162 a month when I put this thing up here. Okay, so the eligibility is you can't be enrolled in or eligible for private or government insurance. The income guidelines is $21,660. You have to be below that amount. And there's a telephone number for it if you want to check out Special Care or go on the internet for it. The CHIP programs are for children. You can see here how excellent these programs are. Pennsylvania is actually terrific. It's called CHIP Cover PA Kids. 4-person household with a $60,000 income is $60 a month per child. Okay, for comprehensive health insurance. There's no reason why every child should not have health insurance. Then there are non-insurance options. We mentioned the sliding scale clinics. There's, it's not find a clinic, I'm sorry, it's find a health center is where you want to go. You might be able to find a clinic. You also have here specific Pennsylvania clinics, the Be Well website, and the Pennsylvania Association of Community Health Centers. I give all three of these because some of these sites are really, really terrific in that they tell you exactly what those clinics do, and some of them, amazingly, you're very lucky in Philadelphia, some of them do dental. And dental is a huge problem in this country. I mean, it's just as, even dental insurance only pays $1,000 or $1,500 towards it, and so you may want to look into that. There are also for-profit urgent care centers like Concentra. Retail clinics in pharmacies. I don't know yet if you have these in Philadelphia yet, where like a Duane Reade or a CVS, and there's actually a doctor there or a nurse practitioner, and they'll see you right away. I'll never forget the first time I saw it, because it was like walking into a delicatessen where they have bologna sandwiches and liverwurst sandwiches, and it has the price next to it. But instead, it says up there, okay, strep throat, $79. Have you seen these? It actually gives the amount. So whatever the diagnosis is, that's what you're going to pay for it. The great part is they see you right away, okay? And these are very, very convenient. And unlike almost all healthcare in the United States, you know up front what you're going to pay, right? Generally, you never know that, all right? I have a special health condition. Are there any programs to cover that? The select plan for women. This is extremely important to know about if you are a woman who's uninsured, okay? It's free reproductive related services. The eligibility, 18 to 44 years old, not pregnant, no or limited insurance, with an income below 185% of the federal poverty level. What they will do if you are discovered to have breast or cervical cancer, they will do everything in their power to get you on Medicaid, okay, to get you covered and keep you covered over the course, okay, of the illness. So this is a very, very important program. It exists in every state, and in Pennsylvania it's called Select Plan. Special pharmaceutical benefits, in this case here, it's for HIV/AIDS medications, which are so costly. And once again, you can see there's an FPL limit on that. There's a Healthy Woman program, which is again, free mammograms, women age 40 plus, Pap smears over age 18 plus, must be uninsured and have income under 250% FPL. This program also will get you into Medicaid if you go to one of their centers, but you have to go to one of their centers and you are discovered to have breast cancer or cervical cancer. Medicare, you're so young here, I'm not even going to go through it. I need mental health care, but I don't have insurance. How many times have I said that in my life? Just suddenly woke up in a cold sweat at 3 a.m. Where can I go? These are two excellent sources for low-cost therapy. Both of these centers have associated psychiatrists if it turns out that you need a psychoactive drug. So these are two reliable, good sources for that. I have dental problems with no insurance. What do I do? There's a listing of dental clinics in Pennsylvania at that site. Some people go to dental schools, okay? And I did when I worked at NYU, and I discovered, okay, the worse your teeth are, the more they love you, okay? And I also discovered that you are that semester's textbook. You follow me? So they make you keep coming back and coming back. You also have to be the type of person who's very comfortable having your mouth worked on, or there's a camera like this far away from it, and people are watching you in a theater having your teeth worked on, and your mouth is up on the big screen. If you're comfortable with all of those things, and you'll get good care. It'll be students working on you under the direction of a professor, okay? But they have the latest material, you'll get good care, it's going to cost you half of what it would cost you at a dentist's office. That's what it'll cost half. And this University of Pittsburgh School of Dentistry, that's the clinic address on the internet there. You can go to that. I say negotiate with your dentist, but of course, you know, I believe you can negotiate just about anything, but I'm not sure how you negotiate with the dentist when they put you back in the chair and then put the mask on your face. It's very hard. I find it hard to negotiate under those circumstances. But you can give that a try. Again, this is something that has occurred to all of you one time or another in your life. How can I get cheap or free drugs? Okay, and there's an answer to that. The Partnership for Prescription Assistance. This is a real program. It's created by the pharmaceutical industry, somewhat out of guilt, I think, but it does really work, and here's how it works. If you have a drug, even if you have health insurance, but the cost of that drug is so high that you cannot afford it, you can go on this website. You can download a form. You bring that form to your doctor's office. Doctor fills it out. If they accept you in the program, they deliver for free that drug to your doctor's office. The Actors Fund runs a free health clinic in Manhattan, and we use this program all the time for people. In fact, there was one woman who had come in, and she had macular degeneration, so she was going blind, and the drug cost $2,500 each injection in the eye, I'm sorry to say that, a month. Okay, and she could not afford it, and she received it for free from the company and the pharmaceutical company, and the doctor there at our clinic once a month injects her with that. Okay, so it's a real thing. If you're in that situation, if you find yourself in that situation, this is a real organization, and they're trying to make up for all their greed in their usual business. I shouldn't say that, but you know it's true. One thing that has almost completely changed the drug scene in the United States is Walmart and Target and CVS and these programs where you pay $4 for generic drugs, a month supply, or $10 for a 3-month supply. Those of you who are in retail know what this is called. It's called a loss leader, okay? Because where is the pharmacy located in Walmart? As far back from that front door as they can put it. They'll build an extension to make it even farther back, okay? Because they want to send Little Red Riding Hood on a journey, okay? And on that journey, Little Red Riding Hood is going to pass things like cosmetics, where the markup is 900,000%, okay? And in places like Walmart, I love those tubs of popcorn that divided into 3. You got the caramel, you got the regular one, whatever. And you grab one of those on your way to get, you know, whatever your drug is, okay? But it's a good deal. It's a great deal, and all of these companies have over 300 of the most prescribed generic drugs in the country. It's a real thing. It's a good thing they're doing. They're getting a benefit from it. You're getting a benefit from it as well. In Pennsylvania, this is a program for seniors, for low-income seniors, to get free drugs for them if they cannot afford them through their Part D plan under Medicare. Links and resources, Pennsylvania Department of Health, there's all sorts of great information. Families USA I put here because that's an advocacy organization that is really terrific, and they've been at the forefront of trying to bring health insurance to every American. And then there's the Federal Healthcare Reform website, where you can spend hours and hours and hours reliving this discussion. Okay? And that's it. Thank you. Thank you very much.